Good morning. I am Professor Peter Detmar speaking to you from the UK. I am the inventor of PEP test, having worked on reflux disease and especially pepsin for over 40 years. Through the extensive clinical programs being undertaken across the world, it is our intention to establish PEP test as the new gold standard for reflux disease. My task this morning is to really talk to you about the PEP test clinical evaluation and some of the recent clinical studies which have been published. As you will realise, PEP test continues to be clinically evaluated across the world, and I want to talk to you about 8 very key areas which have been looked at over the last 12 months and papers published describing some of the clinical diagnostic performance. The first slide just lists some of the areas that we've been looking at and the countries where it's been done, because as you can see, there's quite a range of different countries which have performed PEP test studies. And this gives you a list of some of the areas which have been concentrated on. The first area is really in GERD, and in GERD, there's 2 important studies which have been published over the last 12 months. One from the USA, the group in San Diego, and one from China. The group in the USA really looked at PEP test, and we really looked at it for its use as a screening tool in GERD. And they came out with some very interesting results in actual fact, and they tested it at an optimized PEP test concentration of 100 nanograms per mil. And in doing that, they came up with a sensitivity of 93% and a specificity of 95% when testing it at that level. They also came up with the conclusion that it's a very rapid test, and it certainly reduced the diagnostic timing for diagnosing whether GERD was present in the patients. In the second group by Wang in China, here they tested 322 patients with different subtypes of GERD, and they concluded that it had a very important role for diagnosing GERD and relating disorders. They also tested it as a complementary test with 24-hour esophageal pH monitoring. And the conclusion which they came to was that it improved the diagnostic efficacy when you had the PEP test and the 24-hour pH test together. And this is really because the 24-hour pH test was mainly used for diagnosing acid reflux, whereas PEP test obviously monitors reflux across the whole pH spectrum, going up to pH 7, where PEP test is denatured. Second series of tests are in laryngopharyngeal reflux, LPR. And here in the last year, there's been 3 key papers published, one from India, one from the UK, and one from Italy. In the Indian study, they looked at 120 patients with 82% pepsin positive. And in India, they frequently use as their main diagnostic tool the reflux symptom index, the RSI, and the reflux finding score, the RFS. And they really wanted to correlate the PEP test with their 2 standard tests. And they found a very highly significant association of PEP test in combination with RSI and RFS for diagnosing LPR. In the second study in the United Kingdom, this was done in over 1,000 patients, LPR patients obviously, across 5 voice centres in the UK, various regions of the UK. And here they wanted to look at 2 things really. One thing was to see if the diagnosis which they had entered their studies on, i.e. LPR, did agree with the PEP test. And they also wanted to see what the correlation was like between voice centres across different groups, analysing and diagnosing LPR patients. And here they found the prevalence of pepsin in LPR ranged from 69.2% to 85.8%, depending on the center which was looking at it. The overall sensitivity in this study was 76.4%, with a very good specificity of 100%. The third study in this series in LPR is a very interesting study. This is from Italy, and I think it's the first time that this has been really looked at, and they were looking at the presence of pepsin in patients' tears. So these were all laryngopharyngeal reflux patients, and they were seeing if they collected the tears from these patients, they could detect pepsin. And they found that out of a group of 50 patients, they found 32 or 64% of them had detectable pepsin in their tears. Unfortunately, because this is the first of this type of study, there was no control group. But they did find that the pepsin tear concentration significantly correlated with the LPR severity scores. So the higher the scores for LPR in these patients, the higher concentration of pepsin in the patient's tears. The next study again is quite a first for using PEP test, and this is again a study from Italy, where they looked at the use of PEP tests in the emergency department. This particular hospital has a lot of patients with acute chest pain in the emergency department, and they wanted to exclude acute coronary syndrome, or ACS, from these patients. And this is really to avoid unnecessary referrals for patients having to have further cardiological examination. And out of the 82 patients studied, 74% of them were pepsin positive. So in other words, there was a lot of diagnosed reflux patients presenting in this clinic with chest pain. And using their protocol cutoff at 46 nanogram per mil pepsin, this study had a sensitivity of 88% and a specificity of 87%. And so they did conclude from this study that PEP tests could be used to identify those patients attending the emergency department with chest pain and really diagnosing reflux rather than having the patients undergoing further testing. The next study is on obstructive sleep apnea. Now, on obstructive sleep apnea, it is quite common in the population. It's probably generally about 5% of the adult population in the world really do suffer from this. And they found in this study, taking patients who were diagnosed with sleep apnea, that 32% of the patients were positive for pepsin. And there was also in this study a very strong correlation once again with the reflux symptom index and the reflux finding score, which is a test which they often commonly use in these groups of patients. The next study was a study out of Australia, and this again is a first for PEP tests, really, looking at esophageal atrasia, EA, in children. And this is really looking at children who have reflux aspiration. So salivary pepsin was used to detect the reflux aspiration in these children and just see how that could be associated with other GI symptoms such as GERD symptoms. And they found that there was a significant correlation between gastroesophageal reflux and wheeze in children with EA. Again, this is the first time this type of study has been done. So it did have its limitations, but we now know that this study can be done in a much larger population of children. And the conclusion that they came to was that salivary pepsin was detected in significantly more EA children with GERD symptoms of regurgitation, vomiting, and histological evidence of reflux esophagitis. So again, PEP test was able to show a very, very strong correlation in these patients. Now, the next couple of studies is a very interesting area because, again, it's using PEP test for a first time as a self-diagnostic test. Now, we know that there's a vast number of individuals who suffer from reflux-related symptoms who have never really had a formal diagnosis, i.e. they suffer from the symptoms, and one of the things they might frequently take is over-the-counter medicines, such as antacids, depending on which part of the world they're probably coming from. So some recent studies were done in a population of self-diagnostic individuals in the UK, 739 of them, and they found that 68% of those individuals who were self-diagnosed, and remember these have never had a formal diagnosis of reflux, were pepsin positive. A similar number, 793 individuals in the USA, also self-diagnosing with reflux-related symptoms, were tested, and in this case 62% of them were positive for pepsin. And the conclusion is from these subjects or these individuals who had never had a formal test, many reasons for that, is that PEP test gave them a very rapid test, a very convenient test. In other words, they didn't have to go and see go to the hospital or see their primary or secondary consultant. It was easy for them to use, i.e. they could take the test at home. It was very cost effective compared with having a non-invasive diagnostic test. And I think one of the most important things for these people who are self-diagnosing is that there was no waiting time. They liked the fact it was a non-invasive test as well, so they didn't have to have a tube in place for 24 hours. But what they did like was the fact it was quick with no waiting time. So again, that's another first for the use of PEP test with patients with reflux-related symptoms. Now, another test, another study which has been completed in the last 12 months was in tooth erosion or tooth decay with salivary pepsin. I think we all see patients who have problems with their dental problems, and we assume that is due to gastric refluxate, which contains pepsin, as well as obviously acid and bile acids. And really, the test really wanted to see if pepsin was really involved in that tooth erosion. And in this case, again, it was a reasonably small test with only 50 dental patients. And they were tested to see really if the pepsin, which was present in a lot of these patients with tooth erosion, was really a causal factor, or was it the low pH in the acid which was a causal factor? And the general conclusion from this test was that there's no correlation between pepsin and tooth erosion, which is quite a very interesting finding. Now, the last series of studies, again, there's been 2 key studies published in the last 12 months, was really a common question which we're often asked about PEP tests, was how it compares with the current gold standard, which is looked at across the world as impedance pH, both in GERD and in laryngopharyngeal reflux. So there was 2 studies done, one in Turkey and one in Australia. And in these studies, in the first one, the Turkey study was looking at patients with both GERD and then a separate group of patients with laryngopharyngeal reflux. And really was looking at seeing if PEP test detected the reflux disease in patients as well as the impedance did. And here there was PEP test gave an 80% correlation. So very closely marked and very closely agreed with what you get with the gold standard, i.e. the impedance. And the conclusion from the investigators in this study was that PEP test was a good first-line diagnostic test, very easy to use, very quick to use, compared with using impedance which is obviously quite slow, and you do get trouble with patient compliance. So again, PEP test came out very, very favorably in both GERD population and LPR population. The second study was one in Australia, which really came up with similar findings. This time it was samples were taken simultaneously in LPR patients only this time. So samples were taken simultaneously from the patients at the same time as they were having their 24-hour impedance test and salivary pepsin test. And in this case, PEP test was 77% sensitive with a positive predictive value, a PPV, of 87%. So really, really, really good finding. And again, the conclusion was there's a very good correlation here between PEP test and impedance pH testing. And again, the investigators in Australia came up with the conclusion that it was a very good first-line diagnostic test. And so what they concluded by saying that was that those patients who were maybe negative with PEP tests in this group would have a repeat test with the impedance to see if they got different readings. So, thank you very much for listening, and that really concludes this very, very quick, short trip traveling through the studies which have been completed over the last 12 months. There's been many other studies published as well, again, in very similar areas to those I described. So thank you for listening. Goodbye.